ESMO 2019 has been a prostate ESMO. We have had really practice-changing results presented here. First of all, the CAR trial, then the profound olaparib trial, and finally, critically important information about the need for genomic profiling of advanced prostate cancer DNA, which will inform patient care for the future. ESMO 2019 has given us really critically important information about the best sequence of treatments for patients with advanced prostate cancer. We have learned through a trial called the CAR trial, which randomized patients who have already had docetaxel. They've randomized patients to cabazitaxel or abiraterone or enzalutamide in men who have already had docetaxel and the other alternative hormonal agent, enzalutamide or abiraterone. And this trial has shown unequivocally that cabazitaxel is far superior to the second next generation hormonal agent for both PFS and overall survival and quality of life. And therefore these data really now, in my mind, convince us that cabazitaxel is the drug of choice in men that have actually had cancer progress despite docetaxel and one line of next generation hormonal drugs like abiraterone or enzalutamide, with major survival and symptomatic benefits. Profound was a randomized phase 3 trial treating patients with advanced castration-resistant prostate cancer who had previously had at least one prior line of next-generation hormonal agents such as abiraterone or enzalutamide. They could have had docetaxel or not have had docetaxel, and these patients all had a DNA repair defect, and the randomization was to olaparib or the remaining next-generation hormonal agent, enzalutamide or abiraterone. The trial has shown a major improvement in PFS, progression-free survival. The hazard ratio is very impressive, and despite 80% of the patients, 80%, crossing over in the control arm to olaparib. So really the trial is comparing early olaparib versus late olaparib, despite that there is a clear statistically significant survival advantage in this trial, although this advantage does not meet the pre-specified boundary yet because the data are still early and we need to get more events to fully read out survival. So overall I'm very hopeful that these data will result in approval of the first PARP inhibitor for treating advanced prostate cancer, and importantly, this will be the first time we will have molecularly stratified prostate cancer based on DNA repair defects. Specifically with this trial, we're talking about genes including BRCA2, BRCA1, HCM, and to a lesser extent, drugs, genes like PALB2 and RAD51, and maybe even FANK. So, we have 20 to 30% of prostate cancers that are like this, and this will be the first time we've ever done this stratification for prostate cancer at any point in time. After ESMO 2019, we are now clearly in a new era of prostate cancer care, an era where molecular testing, DNA testing of the tumor is going to become really necessary for us to think about patient selection. We have had a whole session at this ESMO meeting on holding tumor boards to actually discuss genomic testing with several outstanding talks from really key people in the field. And we've heard how these tests can not only help us to give patients drugs like PARP inhibitors that work for the BRCA cancers, but also immunotherapy, PD-1, PD-L1 targeting drugs that have anti-tumor activity, particularly against the 5% or so of advanced prostate cancers that have a mismatched repair defect, as well as another 5% that have biallelic loss or mutation of CDK12. And these cancers can have amazing responses to immunotherapy that can last years, and this is a very important new arena for us. So from now on, we believe we have to start planning genomic testing of every man with advanced prostate cancer. And critically, we now know that up to 12 to 15% of these men, depending on where you are geographically, have in fact germline mutations of these DNA repair genes, which can be inherited and increase risk of cancer. And therefore this actually will result in cascade testing to the family members of these men with advanced prostate cancer who have these germline defects. So these discussions, these results are going to have a major impact on how we manage prostate cancer patients and their families moving forward beyond 2019.